Something that South Africans will be asking as we head towards the NHI. 200 billion rand, that is the figure that was allocated to the health budget in 2018. It is, in fact, 14% of the total budget, Michelle. It's the third largest item on budget 2018. But what government is saying is that it's going to get a lot more bang for its buck by teaming up with private healthcare providers. It says that the infrastructure is already in place in the private sector, and if it teams up with them, it's going to provide a much better service to all South Africans. Now, this is an important stat here, Michelle. What you're seeing there is the medical aid coverage in metro areas. So just over a quarter of all households, Michelle, in metro areas, South Africa's big cities, have at least one member who is part of a medical aid. The vast majority, Michelle, 74%, have no medical aid coverage whatsoever. So just giving you a sense of government's logic, it really wants to ensure that every South African has access to quality healthcare. Let's take a look at this figure. This is also important. So this is the General Household Survey from 2016, Michelle. And what researchers did is they went to households and said, when you have a first consultation with a doctor, someone falls ill or there's an emergency, what facility are you most likely to use? And as you can see there, Michelle, more than 60% using a public facility, just over 36% using a private facility. And the research is essentially finding that that's a matter of funding. So really, they just don't have medical aid coverage, so they choose where they can to go to a public facility simply because it's cheaper. Now let's hone in on some of the metros, Michelle. We are going to start with Johannesburg. And what you're going to see here is the percentage of households which have medical aid, and again, the percentage of visits really to public facilities. When people have an option, do they use the public facility or the private facility? And what you're seeing there, Michelle, a very low percentage of medical aid coverage and a high percentage of people, again, using the public facilities most of the time because they have no other option. So we're going to scoot through some of the other cities. Let's go to Tshwane, Michelle. You'll see a similar situation there, 33% medical aid coverage. Let's go to Cape Town, the mother city, slightly higher for that one, 28% medical aid coverage, 50% use of the public facilities. I think Ekurhuleni is up next. Yeah, 26% medical aid coverage. That's really the average figure pretty much across the board, Michelle. And let's take a quick look at Mangaung, also known as Bloemfontein, 21% medical aid coverage, 63% use of the public facilities. Quickly along the coast, we'll go to eThekwini, 21% there. A substantial amount of people using public facilities there, Michelle. So perhaps in Durban, quite a lot of pressure on the public system. Buffalo City, very quickly, as we go to the Eastern Cape, 19% medical aid. And finally, Nelson Mandela Bay, again, very low, Michelle, just 22% medical aid. And again, a high reliance on public facilities in that particular city. So, Michelle, let's move on very quickly and just get a sense of how we're going to pay for all of this. Well, government says that it will rely on general taxes. It'll pump general tax money into the system. You'll also be making a contribution if you are employed as an employee off the back of your salary each month, and your employer will also be making a contribution. So working very much as it does at the moment with private medical aids.
And that's regardless of whether you have your own private medical aid as opposed to whether you'll be using the NHI?
Absolutely. So you can have both your own private medical aid and the NHI fund, but then you'd really be duplicating your payments. And what government is saying is that it's no longer going to provide tax credits for your private medical aid. So there is less of an incentive for private medical aid funding. It's going to make private medical aids much more expensive.
Well, a lot to think about there. And we'll continue our discussion with you, Michael Marillier, just unpacking some of the background, some of those tricky numbers around the National Health Insurance. We'll bring you more on that story throughout the day right here on the channel.